The following is a summary of the health plan for the employees of AHR Metals for July 1st, 2018 through July 1st, 2019. My name is Barry Hamrick. You can reach me anytime at 205-222-9440 or via my email rbhinsurance@gmail.com. Your new health plan has two parts. First, there's your primary plan through Blue Cross Blue Shield of Alabama, and now you have a new GAP plan or secondary insurance plan that will pay most of your out-of-pocket for major medical expenses. It's important to know how this plan works to be sure it's working for you just as it should. I think you will agree this is an amazing plan, but only if you know exactly how to use it properly. So let's go over the timeline. Step 1, give your healthcare provider both of your new insurance cards, Blue Cross of Alabama and your GAP plan card. Step 2, your healthcare provider files the claim with Blue Cross of Alabama. Step 3, Blue Cross processes the claim. This will generate an EOB, or explanation of benefits. With the traditional plan, this is normally where the healthcare provider would send you a bill. However, with this program, they will now file that EOB along with the original claim to your GAP plan. In turn, your GAP plan pays your healthcare providers directly until your funds have been exhausted. So for most of you, this will eliminate out-of-pocket for major medical claims. So let's take a look at the details, your health plan coupled with your new GAP plan. First of all, please notice, your new GAP plan will not cover pharmacy benefits. You will continue to have co-payments for those. However, there's a lot you can do as a consumer to control those costs. We'll talk more about those later in this presentation. So let's talk about what the plan does cover. You will note the health plan covers 3 office visits at $30 per office visit. Without a GAP plan, those office visits would then apply towards your $3,000 deductible, and then you'd be responsible for 20% of the bill after that. The good news is, after those first 3 office visits, your GAP plan will pick up those expenses as part of your $2,500 outpatient major medical coverage. You will have $2,500 to spend first dollar for all things in yellow. Keep in mind, this is just a summary. It does not depict everything that your GAP plan covers. Basically, if it's a covered medically necessary claim by your primary plan, and it is not a mental health or substance abuse claim, it should be covered by your GAP plan. Things like emergency room visits, outpatient surgery, major diagnostics such as an MRI, lab work done at an office visit, durable medical equipment, ambulance rides, chiropractic services, and physical rehabilitation. You'll note the health plan has a $3,000 deductible, but your GAP plan is going to pay the first $2,500 of that deductible for you automatically. In addition to that, the GAP plan will pay $6,000 towards a hospital stay. Since your GAP plan provides $6,000 towards a hospital claim, that means your out-of-pocket potential for a hospital stay is 0. Please also be aware the GAP plan is not designed to cover elective procedures such as vasectomies. A good rule of thumb is if it's a covered medically necessary claim with your primary plan, and it is not a mental health or substance abuse claim, it should be covered until your $2,500 outpatient and $6,000 inpatient benefit has been exhausted. So this plan basically eliminates major medical out-of-pocket for most of you, since you will likely not exceed your $2,500 and $6,000 benefit. Okay, so this is probably the most important part of this presentation. As mentioned previously, your GAP plan does not cover your prescription benefits. Your costs for Tier 1 medications are no more than $15, Tier 2 no more than $50, Tier 3 no more than $70, and on rare occasion for specialty pharmacy, no more than $395. However, as a smart consumer, there's a lot we can do to control those costs for medications that cost more than $15. Typically, when you are prescribed a medication in the Tier 2 through 4 category, it's because there is not a generic available for it yet. Did you know that most every pharmaceutical company supplies a copay card to get your costs down for those brand name drugs? It is recommended that you go to goodrx.com. That's a great tool for finding more about your copay cards and learning more about your prescriptions. blinkhealth.com is a great website to check to see if you can get your generic drugs at a lower price. In addition, needymeds.com is a great way to find out if you qualify for a patient assistance program. You may be able to get your exact same medications through that program for free. Basically, the message here is clear. If you are taking a medication that costs more than $15, there is probably a copay card or discount card made available from the pharmaceutical manufacturer. They are easy to locate and easy to use. Just Google the name of your medication, followed by copay card or savings card. This can save you a lot of money. Plus, I am always here to help. If you want to find a way to get your prescriptions at your best price, please call me 205-222-9440 or reach out to me via email rbhinsurance@gmail.com. I mentioned earlier, this is an amazing health plan that gives you first dollar coverage for major medical, but you do have to monitor it to make sure it's working for you properly. So let's talk about what to watch out for. Number one, be sure to give both of your insurance cards to your healthcare providers every time you use it. Number two, it sounds simple. Just open your mail to monitor your claims process. You will get a paper trail showing exactly how your claims have paid. If you happen to get an unexpected invoice for a balance due, take note if it's been filed with your GAP plan. Just about the only thing that could go wrong would be your healthcare provider could neglect to file the claim for you. They don't mind filing the claim because it is an efficient and fast way for them to be reimbursed. So simply call the number on that invoice, have your GAP plan card handy, and give them that information so they can file the claim. If you have had several claims or a large claim, it's possible that you've exhausted your GAP plan benefit. You can always call the 800 number on your card to confirm benefits and to see if your GAP plan has paid a claim, and check your available balance. If you're still having problems, you can always reach out to me and I'm glad to help. I care about making sure this health plan works as best as possible for you. If you ever have any questions or problems, feel free to reach out to me directly at 205-222-9440. You can email me anytime at rbhinsurance@gmail.com.